As you know, colon cancer has impacted our community and it continues to rise. We know that being screened and being screened early makes a big difference in the outcomes of our patients. East Georgia has worked many years to move forward the conversation of colonoscopies to a topic that is discussed now without embarrassment, as you see.
So we partnered with Georgia Core to develop this grant, and we were able to get East Georgia as one of our key partners for that effort. And so through that, we've been working on this for the last 3 years. We were awarded in 2020, we were fully implemented in 2021. So for the last 2-3 years, we've really been working aggressively on training and process improvements, as well as providing colonoscopies and stool-based fit test or stool-based screening tests to try to get patient screening. So we've seen the numbers go up significantly in this region. So when we first started this, we needed to do something. The screening rate here was around 30%, and the screening rate around the state was 70%. And so over the years of doing this program, we've got that screening rate up to 45%. And so that was in the course of about 2 years of full implementation. We've got up to 45%, so that's very impressive, and the program's still ongoing. That represents about 6,500 patients that were screened, and we found 77 precancerous lesions so far. That's 77 patients that would have gotten colon cancer had we not removed them through this program. And so that's a really exciting, those are folks in this community that would have been affected that we were able to prevent.
Georgia Core was actually the grantee on this project. So when the State Colorectal Cancer Roundtable came to us and said we need a state agency or a state entity to come forward and actually apply for the grant with the CDC. So Georgia Core is the administrative part of this grant. We now have the evidence to show that we've been successful. So in the next grant, we hope to expand to even more places. But right now, Southwest and Southeast Georgia have the lowest screening rates for colorectal cancer in the state. So that's why we targeted these areas, and then we hope to grow from there.
There's a test itself that we use called it's called a Hemocult test, and so this is like a little $5 card that patients can take home. So for patients that don't have access to colonoscopy, this is a really great alternative in that it doesn't really cost much, and there's no bowel prep required, and so there's no time off of work, and so they take this test home. And they just do it. Now, a lot of providers either don't know about it, or if they know about it, they're not really utilizing it as much. And so part of this program is to get providers comfortable with using this test. We also have a partnership with Exact Sciences. So they're the ones that do the Cologuard, which is a bigger test. It's a box. It lasts for 3 years, but it's still stool-based. And so Cologuard has actually agreed to give us free tests for all of our clinics within the system, because usually it's a $700 test. And so that's also another great partnership that came up through this program. You have patients coming in with diabetes, with hypertension. They need all kinds of screenings, and so until somebody's really focused on a specific type of screening, you're probably not going to think about it. And so part of it was just bringing colorectal cancer screening to top of mind. In residency, we would see patients come in with advanced colon cancer. I used to work in the rotate in the oncology clinic, and also rotate in the emergency room and in the wards, and we would see patients come in much later than they needed to. And so by the time you get to stage 3, stage 4, you need chemo, versus if it's stage 1 or even earlier, which is precancer, you just need a little polyp, sometimes a polyp removed, or sometimes part of your colon removed, which is way easier than getting chemo. And so we were just seeing patients that we could have avoided all of this this needless sickness in all these patients. And so that's what kind of inspired me. And then that, plus seeing how the screening rate at FQHCs, at Federal Qualified Health Centers, were so much lower than the rest of the state, was really why we decided this is where we need to go and what we need to do.